Now we're going to cover prone hip extension. Obviously, if we're doing hip extension, the main muscles we're going to be working are the gluteus maximus, shown here in green. That's the major hip extensor. But of course, we also have the hamstring muscles. So right here we have semitendinosus. This would be semimembranosus, a little bit deep to that. And then the lateral muscle, biceps femoris. Now, when we do a prone hip extension, we're going to begin this exactly the same way that we did quad sets and straight leg raises, and also side lying hip abduction. So you'll see this in a second in the video. But we want to first dorsiflex the ankle and hold that. And then contract the quadriceps while maintaining ankle dorsiflexion. And so while maintaining both of those, we're going to extend the thigh at the hip joint. So you'll see that here. So there's ankle dorsiflexion, quad contraction, and while maintaining both of those, I go into hip extension like that. Hold it up top for a few seconds, and then slowly bring back down in a controlled manner. And then I can relax and reset. And then again, the second rep, ankle dorsiflexion, quad contraction, and then hip extension. You'll notice the entire time, again, that thigh is in the air. I'm maintaining quad contraction and ankle dorsiflexion. I don't relax those until the leg has returned to the starting position on the table or the floor. Now, when you're doing prone hip extension, you'll probably want to have the feet dangling off the edge, because if the feet are still on the table, it's going to be a little bit difficult to dorsiflex the ankle, but that's something easy to fix. Now, there's a couple disadvantages of prone hip extension in the way I'm doing it here. One disadvantage is the limited range of motion at the hip joint. So we're beginning from neutral. And from neutral, the hip only extends about 20 degrees on average. It's a pretty small range of motion compared to hip flexion. So we're not really going through a great range of motion. The second thing is, in this position, it's actually difficult to minimize the lumbar paraspinal activation. That can be a problem, especially if you've got a patient with an acute flare-up of low back pain. They may not tolerate this exercise very well, but you may still want to strengthen the glutes and the hamstrings. So you can actually vary this exercise a little bit, and instead of doing it in full prone, you can do it in a bent over position. So you want to actually line up your hip crease right on the edge of the table right here. Okay? So there's my hip crease. That's basically where my hips bend. That goes right on the edge of the table right there. And then I'm, of course, going to hold onto the table on either side with my hands. And then the same thing applies. Ankle dorsiflexion, quad contraction, and then I go into hip extension. Now, of course, here I'm beginning in a hip flexed position, not from neutral. So I can go through a larger range of motion. That's one advantage of the bent over hip extension. Again, we're bringing that thigh up to parallel, so as we go up to parallel, gravitational torque is increasing, meaning this exercise can become a little bit more difficult and more challenging, which can be good, towards the top of the movement. It's also pretty easy to progress this one. You can do it against TheraBand resistance. You can also tie an ankle weight around the ankle to have the hip extensors move against more weight. If it's a little difficult, you can do a smaller range of motion like I'm showing right here. The other thing you can do to progress it is you can do both legs at the same time. But again, ankle dorsiflexion, quad contraction on both sides, and then you move up to the top. Sometimes this exercise right here you'll see referred to as reverse hypers or reverse hyperextensions. But regardless of how you're doing this exercise, you'll have the hip crease on the table, arms holding on to something on the table, whether it's a handle or sides, and then that ankle dorsiflexion and quadricep contraction are maintained throughout the duration of that lift. And only relax once that leg comes back down to the floor.